PHS-2 Rapid Deployment Force, or RDF, is a Commissioned Corps response team of 125 medical professionals. Their skill sets include most major parts of the medical field, including physicians, nurses, veterinarians, pharmacists, dentists, behavioral health professionals, and other public health professionals. This team is based out of Washington, D.C. and can be wheels up on the way to a response site within 12 hours of mobilization. The Gulf Coast hurricane on the horizon, the PHS-2 team was deployed to Alexandria, Louisiana in advance of Hurricane Gustav in August of 2008. The team set up a federal medical station, the first PHS team to do so, in a convention center where it cared for 200 patients before, during, and after the direct overhead passage of Hurricane Gustav. In January of 2009, PHS-2 was called upon again, this time to provide care for the crush of attendees in the inauguration of President Barack Obama. Then in 2010 and 2011, PHS-2 team was called upon again, this time to help with the needs of underserved and vulnerable, as part of HHS's Community Health and Support Missions, or CHASM for short. The CHASM missions were to rural areas of Tennessee and Kentucky. During these missions, the team played a supporting role to the remote area medical organization in providing free dental, vision, and medical services for local populations. The team also provided sustainability, public health education, and instruction. All told, services were provided to nearly 2,000 patients during these missions. The team is on call every 5 months. It holds in-person team meetings in the months before, during, and after all call periods. At meetings, team members are kept up to date on latest issues affecting response teams, provided with training to aid in future deployments, and the opportunity to continue to build relationships that will help sustain them through difficult future deployments. Being on a response team is not for everyone. It requires sacrifice of personal time, willingness to go above and beyond, and a willingness to learn new skills and, in the end, do what is necessary to fulfill the mission.
For me, being on PHS-2 is about doing what I joined the Corps to do. It's getting in the field. It's reaching out to people that actually need our help. It's serving a mission that's bigger than us.
We'll shine. I have no doubt on that. You know, we're a team that will get the job done, no matter what the job is or how much time you give us to do the job. But we can do some extraordinary things, and it's made me appreciate the work that goes into these things. You know, we don't just show up and because of our day jobs we know what we're doing. It takes a special person to be on a Tier 1 team, and it takes an extraordinary person to be on PHS-2.
You don't hear people saying, no, I'm not going to do that. It's egoless devotion to what we have to do. And I don't know how you teach that. That's just how these people are.
PHS-2!
Second one!
Throughout its brief history, the PHS-2 RDF has been a pathfinding team. There were commissioned officers who were willing to put service above self to serve a cause greater than themselves. If this sounds like an opportunity you might be interested in, we invite you to contact our recruiting officer.